A very good evening and welcome to one and all present here for the international webinar series DENTOPHARM 2022 on topic Things to Know About Biocompatibility of Medical Devices. I'm Dr. Ramya, part of Dental Education Unit and Senior Lecturer at Sri Balaji Dental College and Hospital. Will be highlighting you about this program today. I would like to welcome our chairperson, Dr. Srinivasan ma'am, Registrar Dr. Bhuminathan sir, Principal Dr. Jimson sir, and Dr. Sumati Jones ma'am, Head of the Department of Pharmacology at Sri Balaji Dental College and Hospital. Over to Sumati ma'am to share a few words on today's webinar.
Welcome to webinar. Thank you for joining this international webinar series DENTOPHARM. We have with us Dr. Prakash, who is renowned pharmacologist and toxicologist. He'll be explaining in detail about biocompatibility of medical devices today. Over to Ramya for short introduction about speaker.
A little announcement before we begin. If you have any queries during the presentation, you can post the questions in the comment box provided below. Now, I warmly welcome our guest speaker, Dr. Prakash Srinivasan, who is currently working as a senior toxicologist at Avinos Medical in Alpharetta, Georgia, United States. He was previously contracted as an SME biocompatibility at Baxter International in Round Lake, Illinois, and Johnson & Johnson medical device sector. He has an MSc and PhD in specialization of pharmacology and toxicology with chemistry from the University of Madras, Tamil Nadu in India, and also has completed his postdoctoral research at Tulane University. He has edited 4 books, contributed several book chapters, and also published research articles in various peer-reviewed international journals and conferences, proceedings, and abstracts. We welcome you, sir.
So I would like to introduce myself. So my full name is Prakash Srinivasan Timiri Shanmuga. Currently, I am working in Avanos Medical as a senior toxicologist. So I am part of the medical device testing for the safety of the medical device for the global product. And so I would like to say the disclaimer. So all the presentation and all the thoughts, views, everything is solely responsible of my thinking and what I read and what I understand only. It's nothing about my company, or it's not anything related to my company policy, or not about my company view or anything. It's anything what I'm going to talk is mine only, my idea only. So this is a disclaimer I want to give it before start our presentation. So today our presentation topic is things to know about biocompatibility of medical device. So before go to any introduction, I would like to say what is medical device. Actually, any instrument or apparatus or anything, if we are going to use to diagnose the disease or to prevent the disease or to monitor the disease or to give the support of anatomy, body anatomy, or for anything for the physiological process, then we can say that one as the medical device. Actually, the dental dentist, so they are using a lot of medical device. I can say that without any medical device, they can't do anything. So for teeth arrangement, teeth filling, and for everything, they are using the medical device. So maybe in future, now or in future, they have a lot of job opportunities like consultant, because for to design any device, they need the corresponding person suggestion. So maybe they can go to for the consultation, and also if they have some of the chemistry knowledge and extractable, leachable, and toxicology knowledge, then they can go for the chemist or in the extract and leachable section or in the toxicology section. So this one is the most important, the knowing the medical device and what are the things they have to learn about the medical device, at least from the biocom side. Then it will enhance the job opportunity. That is the reason I chose this topic, because most of the, as I said earlier, most of the most of the dental devices are having the body contact, direct body contact or indirect body contact. For an example, here you can see some of the stainless steel instruments touch the um, stainless steel plate. Maybe it may be used for sterilization or it may used to place the device, but this also have that indirect body contact. So we have to test this stainless steel plate also along with the stainless steel instrument. So that is the reason. So at least what are the field they have to learn means chemistry, extractable and leachable, toxicology, and if they have knowledge in sterilization followed by stability, then it will be good to them. And so the chemistry means you no need to know about the very in-depth chemistry. For an example, what is the A plus B, what is the reaction it will give, or you don't want to know about all those things. Even that basic chemistry knowledge is good enough, or at least we have to learn about some of the basic chemistry knowledge. That is the one. And extractable and leachable. Most of the, as I said earlier, the dental devices are go in contact with the body. So if you know about what is the extractable and leachable or what kind of leachable it come out from the device, then it will be good to dentist. And also it is good to if you are in consultant position, then it is good to develop the device which is the less leachable, because what else you are going to put it in mouth, it will go to that stomach and it will go to liver, and it obviously it will go to that after the first pass metabolism, it may go to the blood. So it will be in the circulation all over the body. So we can avoid if we know about that leachable. And also with the help of the toxicology, we can make the device with a less adverse effect or without any adverse effect and side effect. And also in the sterilization part, some of the device when we sterilize, um, based on the sterilization mode, it may create some toxic effect. So we have to know what kind of sterilization is good for the material what we have in our device. So basically, ethylene oxide or steam sterilization or gamma sterilization is mostly used. And so we have to know what kind of material we have and what kind of sterilization is good enough to do the sterilization. And so which one gives more stability to the device also. So these are all the some of the things we want to know. So before go to that chemistry part, I would like just to say about some of the few general things. Actually, sea salt and sodium chloride both are giving the same taste, but sea salt and sodium chloride are very different. Actually, one of the incident happened in my life. So when my wife was pregnant, that time doctor find out her BP level went little bit high, and she asked whether you changed anything currently, especially in the food, and they particularly asked about the salt. I said yes, I change your shop, and I am getting this kind of salt. And they said it's a sodium chloride. So sea salt is good, and so go with the sea salt. So immediately we change into sea salt, and we found that BP level getting normalized. So I understand that both are having that different effect, but sodium chloride is synthetic material, and obviously it has some side effect. So why I'm telling this means this is the basic chemistry. So we have to know about that one. And also sugar and high fructose. Sugar is natural, and also the high fructose is synthetic one, but both are giving the same taste only. So if we go for based on the taste, the high fructose, everyone knows that it won't get easily metabolized in our body, so it stays in our body. Because of the accumulation, diabetic will easily trigger out. So that's the reason we have to know the basic differences. And also the next one is a good example is color. People are very much interested to see the color, and even in the food item also they are very interested to take that coloring food. But most of the coloring foods are giving lot of troubles. For an example, the FDA, if you go to the FDA website and if you search, then you can find about that. Lot of colors have some behavioral effects. So avoiding the color is very good. For an example, few generation back, what else the parents say, the child obey. But nowadays, what happened? Um, Something that behavioral changes are happening. So, but we are feeding the coloring, and we are saying that some behavioral changes are happened. It's the parent fault only. Most of the time, it's a parent fault because they don't know what kind of coloring they are feeding, um, and a lot of behavioral changes are happening. And even if you read in depth, you can understand that most of the colors are come from that kind of coal tar, which is not good for the body. And even if you see that a yellow fire, this is the one good example. Okay, if you the yellow color, or if you go to see that any intense color, or which is more, if you add more than the serving time, then what happened? Some of the chemicals may trigger the cancer cells. So it may be a carcinogenic also. That is the thing. And also you from friends or from that general newspaper, you can see that as if they are applying the air dye, or whenever they are applying some of the things, what happened? So because of the coloring, they may get lot of allergic effect, and even sometimes it may cause the skin cancer, those kind of effect also. So the chemistry is a very big part in our life, and we have to know about that basic chemistry. Then only we can select the good material to build up the device. And also it is very good to for what kind of test we have to perform, and what kind of protocol we have to build it up. For everything we need the chemistry knowledge. At least we have to need the basic chemistry knowledge. Okay, so we will go for the chemistry, the first one. So when the chemical characterization is needed, so what time we have to see the chemical characterization. So whenever we are going to buy, the company is going to buy the raw material, that time we have to collect all the material details. So we have to collect all the raw material details. So each company, they have some set of questions, whether it is compliance to FDA regulation, whether it compliance to the European REACH regulation, or whether it compliance to the Japanese regulation. So they have a lot of questions, and also they want to know what kind of material, the raw material, they added in the raw material. So they need that complete ingredient list. If that company provide a 100% complete ingredient list, then that is good enough. Sometime because of the proprietary, they can provide 40% to 60%, or sometimes they can't provide also. So that time it is very much challengeable, but we have to try to collect what the ingredient list. So based on the ingredient list, we can choose what kind of extractable test or leachable test we can provide, or what kind of solvent we can use. Those are all the things we can set it up. So we need the complete ingredient list, and also from the ingredient list, we can know whether anything it is hazardous material is there or not, and whether it complies to that for the regulation. So we need the complete ingredient list of every raw material. And also, as I said earlier, if you want to perform any toxicological or extractable test to build up the toxicological profile, then we need the ingredient list. Based on the ingredient list, it is easy to set up the protocol. Otherwise, we have to do some of the trial test to build up the protocol. And also, we need the ingredient to, when we file for a license, we need that ingredient list. So that is the one another thing. And why we have to characterize the material? Because first we have to identify what kind of chemical it is. For an example, if you see the stainless steel, all are stainless steel only, but the medical grade stainless steel is very higher. And also that if you use for something for food grade, then that medical device is something different, and some of the medical device which is used for common purpose, that is very different. But all are, for our naked eye, if you see, all are stainless steel only, but there are a lot of differences are there. So to identify what kind of chemical is there, we want to know the chemical characterization, and also the quantity of chemical. So how much they added. For an example, if you buy that any plastic, if you see that if it is phthalate, phthalate is one kind of chemical. So if you find anything phthalate, then if it is less than 0.1% weight by weight, then it is compliance to the regulation. And some of the countries says if it is less than 0.1% weight by weight, then it is allowable. But if it is more than that weight, then it will cause a lot of side effects to the body. So we want to know the quantity of the chemical. That is the one important thing. And here I want to say that another one thing. When I went for a shop with my friend, he is going to buy the plate for his dog. So he is not only looking whether it is BPA free, he is also looking for the phthalate free also. So from him, I understand that whenever if I want to buy anything, so I also want to look what are all the hazardous material. This one happened very long time back. So what are the hazardous material, and what kind of material they added in our that food container? Because obviously, what else we eat, it goes to the body. So we have to know about that, at least for our life, and also for the safety purpose. So for the biological safety, we have to strictly follow the guidelines ISO 10993. It is for that biological evaluation, and also for the risk assessment and the risk estimation. So we have to follow that ISO guideline 14971. So to know that chemical characterization, we have to to follow that ISO guideline, we have to know that chemical characterization also. And also, as I mentioned earlier, to know that ingredient, it is good enough to identify the hazardous material, and also to find out the worst case. Actually, worst case and foreseeable adverse effect both are a little bit different. Okay, and how can it perform? So based on the ingredient, based on the raw material, that device performance is getting changed. So what kind of device we are going to build it up, and what kind of it is based on the raw material. Because if you use some of the adhesive, sometimes what happens, if it get leach out because of the adhesive, it will create some of the adverse effect. So I am telling the adhesive, but it depends on antioxidant and all other things. So we want to know about not only that ingredient, means not only that main ingredient, we want to know about all that ingredients up to 100% level. And also it will be helpful to say the material equivalence to get the chemical characterization. Now because of the COVID, what happened, lot of supply chain, they can't provide the material, so supply chain get blocked. So some of the companies, what happened, they want to make little bit they want to go for another company to get the raw material. For an example, if there is any little change, for an example, if they change the color only, then they no need to do all the toxicology test. So if they know what is the existing material ingredient and what is the future material ingredient, if they know the ingredient, then we can say both material is equal only, chemically and physically. Then you can write the justification to avoid the testing, so you can save a lot of money. I'm just telling color, but it will be applicable to anything. If you change the adhesive, or if you even if you change the material, if you show that it is equivalence, then you can go for justification and you can try to avoid all the test. Sorry. So I just want to give this one example because this is very interesting to me. That's the reason I am showing this one. So actually, to purify the heparin, OSCS is used. So what happened in 2008, they used a lot of chemical, because the chemical precipitation has happened. What happened, it killed a lot of people. So to figure out why the patient is getting die, they take a lot of time, because they not followed the pharmacopoeia and they used the chemical lot. That is the reason death has happened. And also, if you administer the heparin for a long time, then it may increase the risk of the osteoporosis. But if you give that heparin, the low molecular weight heparin, then you can reduce the risk of the osteoporosis. If you give the unfractionated heparin, then the risk may get increased. And also, pharmacopoeia clearly mentioned the source of the heparin should be in porcine, not from the bovine. So these are all the things which is readily available in the pharmacopoeia. For the same, for like that, most of that guideline, if you read if you read any of the literature, based on the literature, we can build up the chemistry knowledge and we can know that what kind of material we have to get it. For an example, that is the reason I am showing that heparin. Even in the heparin, see that we have to see the purification method and what kind of source animal we have to get it. All those things are get matters, right? So we have to get knowledge about the chemistry from pharmacopoeia or from that available literature. So now only I discussed about the phthalate. One of the phthalate is the DEHP. So we have to know about the synonymous, that every chemical have different name. So we have to know about that one. Otherwise, we can go just for the CAS number, chemical abstract service registry number. So even the material have different name, but the case number should be the same only. So mostly, if you stick with the case number, then it will be very good enough. And so you can create your own database. So what are the chemical can make what kind of hazardous to human body, then it will be good enough. And as I mentioned earlier, antioxidant and anti-static, flame retardants. So even for the stabilizer, pigment, all are matters. This one for the polymer, but for anything metal or anything ceramic, for any material, if you go, then we have to know the ingredient, and even that small ingredient also makes a lot of changes. Actually, when I say the DHP, I want to say one more thing. Some of the people, they want to get the plastic which is very flexible. So even they don't know, because the manufacturer may add more DHP, that phthalate material. Because of the phthalate, the material is getting more flexible. But what happens if the phthalate goes inside the body? It will obviously create some of the hazardous effect to our body. And not all phthalate are hazardous. In the phthalate, there are different varieties are there. One of the hazardous phthalate is DHP. So that is the one I want to say from the previous slide. And we want to choose the representative product to test. Actually, here you can see that three kind of bottle, but all the bottles are different in size only. But all the bottles are same configuration, and the material proportion also same only, and the physical and chemical property, manufacturing process, coating, coloring, resin, sterilization, storage, um, contact and duration, everything is same only. So these are all representative product. But here you can say that some of the bags, if these two bags have the same, even initially you think, okay, all are bag only, so this may be representative product, but this is not the representative product. If you see the wall, this one both are having the same one, and this one have the two walls, so this is not the representative product. These two are representative, and these two are representative. So first we have to know what is the representative product. Why we want to know the representative product means, based on the representative product only, we can choose the worst case material to test, because we can't test all the size bottle or all material. Sorry, all material for the biological evaluation, right? So we have to know what is the representative product. From the representative product, we can choose the worst case material. In some of the time, the smallest material also the worst case material. So because it's based on the surface area by volume ratio. So this slide will help to know about what is the surface area to volume ratio. So actually here you can see that 2 centimeter cube to 2, 4, 6, 8 centimeter cube. Actually, if you do that surface area by volume ratio, then 2 centimeter cube will get more number than 8 centimeter cube. So we can select that smallest device as the worst case. And actually this slide I like it more, because when I do my PhD, the most important question is, okay, you test the medicinal product in rat. So if it goes to human body, then we have to go for a larger amount of drug. For the answer is no. Actually, the lower animals have very fast metabolic activity. So you have to give large amount of drug. But when go for that bigger animal, their metabolic rate is very slow. That's the reason we are giving very less amount to the higher animals. So it's not based on that size. It's based on that surface area by volume ratio, the worst case material. And also for the chemist or for those who have that involved in that medical product or any other product, even for the pharma also, they want to do the chemical. When you are performing the chemical characterization, you have to aware about that GLP, good laboratory practice, and also ISO guideline 17025. Because for the GLP, they will say that how to make the result, and even they will say how to write the date and how many person has to sign the report, who has to review the report. All those things will be in the GLP guideline. But that ISO 17025 is technical one. How to standardize the instrument, and what kind of control you have to use. Mostly they will perform for the NIST certification chemicals only. And what how many for quantification, what kind of method you have to use, for the identification, what kind of method we have to use, whether both are different, all the things, technical things will be available in um, ISO 17025. So we have to follow both GLP and also the ISO guideline. And also we have to see that whether everything is certified. For the animals, if we are going for animal studies, whether it is certified. So the 21 CFR Part 58, and also for the software also, most of the people think, okay, it may be software only. It's not like that. For most of the software also, we need that certification. So we have to see that what are the instruments we are using, what are the software material we are software we are using, and for possibly we have to get all the certification, and we have to see whether it is strictly follow the GLP guideline and also the ISO guideline. And also we have to see that whether there is any local body notification is required, or we have to see whether there is any other guideline we have to follow. So if you go for that guideline, they will clearly say, okay, if you are going to test the polymer, if you are going to test the monomer, then you have to use this kind of chromatography, either LC or gas chromatography or liquid chromatography. So actually, from monomer only the polymer is getting developed, but in the manufacturing process, some of the monomer will remain stay as the monomer only, and that monomer is very much hazardous material. So we have to know that whether the monomer is not present in the material or not. So far, if you go for any material, the guideline will give that what kind of instrument we want to use to find the hazardous material. So here I am giving some examples. For if it is polymer, if it is you want to see if there is any impurity, then residual on ignition or liquid chromatography. For chemical structure, you want to use that FTIR, and the same for that metals. For material composition, you want to see the material composition, then you have to use the atomic spectroscopy. So, and this is for the ceramic, and another one for that natural macromolecule. So, when I am saying the natural macromolecule, I would like to say some few touch up for the TSC, BSc. Actually, it is not a part of the chemistry, but it's good to know about the TSC, BSc. That's the reason. Because TSC, BSc is a kind of that when we buy the animal source, then we have to see whether it has any TSC or BSc. Because TSC or BSc is the present. What happened? It will affect the brain, and then brain will get kind of spongy. See, This is the normal one, and this is the one you can see that lot of hollow spaces are there. So if the material is in a TSC or a BSC risk, then what happened? It may get transferred to the body and it will affect the human brain, and then brain will get spongy and it will reduce the surface area, and somehow it will get disappear also, and it may create the death also. That's the reason. But don't worry about that. This is not part of the chemistry. I just want to say, because when I am touching the natural macromolecule, it's somehow related. So most of the people, they think, okay, what we are going to get in the extractable, the same or part of that only we are going to get it in the leachable only. It's not right, because based on that ingredient material, we are choosing the solution, that polar, non-polar, or semi-polar, everything. But for when we go for the leachable, we are using the same solution what is in that device. For an example, if it is bottle, if the bottle contains the sodium chloride, then we are going to use the same sodium chloride. That's the example. But if it contains any other medicinal product, then we are going to use the same one, right? So that time what happened? The leachable one, it may give some other different material also. So we have to decide whether that we need the leachable study, or we need the extractable study, or we need both also. That is very much important one. And for if it is implant, then we have to choose polar, non-polar, semi-polar. And if it is for the closed container, like something saline bag or any other bottle which contains that pharma, medical, or anything drug, then we can use that neutral pH or acidic pH or alkaline pH. We have to choose the extraction solvent. And if it get contact with the blood, then stimulated extraction is best. And mostly they will go for the ethanol and water. That is the semi-polar. So they will go for that one. So there are a lot of different kind of extractions are there. So we have to know what we are going to see now. We are going to do that some hazardous identification. Then we have to go for the exhaustive. If we are going for that risk assessment, then we have to go for the simulated extraction. Or if it is the device is going for long time use, then we have to go for the exhaustive extraction. So we have to choose based on that chemical target. We have to choose the kind of extraction. Also, some of the guidelines also help us. So if it is the limited contact means for the based on the duration. Okay, later we are going to see one slide what is limited contact and prolonged contact. So based on the body contact also, they will recommend the extraction method. So by using that extractable leachable study, what are the things we can learn? We can learn what are the ingredients they used in the device. Sometimes if it is proprietary, then they won't give that full ingredient list. Then if we use that extractable or leachable study, then we can know whether it contains any hazardous material or not. And we can know in the processing time all the monomer get polymer or not. So we can know whether the monomer is there or any other manufacturing residual. Actually, in the ingredient you can't see any of the thing, but due to the manufacturing and sterilization, what happened? Some of the ingredient will be accidentally mixed with the chemical or in that material. So everything will show up in extractable and leachable study. So when we do that extractable and leachable study, and if we find anything unknown material, mostly the MS will give, mass spec will give that chemical name, or at least it will give the structure. So it will be easy to calculate the tolerable intake level. Actually, I think I have to go a little bit faster. So, if you go for the guideline, they will give that what are the polar, semi-polar, or non-polar material you can use, and what is the polarity index. So it will be very good to know about what kind of polar or semi-polar if you want to use, and what is the polarity index. Then we can try to get most of the extraction from our device. So now we'll go a little bit into that toxicology. Some of the people get very much confused, and they think that okay, if we see for that substance of very high concern, then we will cover that hazardous. No, hazardous is 100 means SVH is maybe 20% only. So the SVHC, it mainly focuses the carcinogenic, mutagenic, and reproductive, and also that anything for hormone. And so they focus, the SVH focus very small percentage only, but hazardous is means it will cover 100%. So instead of seeing the SVHC, but SVHC is very main, very important, but we have to consider the hazardous material also. So some of the things I write it based on that reach regulation, and also based on that 1272/2008. So these are all that what else you see in the slide. These are all the open source. So you no need to pay anything, or you no need to do any registration or anything. If you go to that, for an example, if you go to that regulation number 1272/2008, if you open that regulation, it's in the PDF format. And if you open that one, you can see that a lot of material which is the hazardous, and particularly it is hazardous for eye, or it is whether it is hazardous for any other organ, they will notify it there. So by using this open source, you can find the hazardous of material. Or if you go to the reach regulation for that, here I mentioned it here, the link. If you open that one, then you can enter the chemical name, and you can see what kind of hazardous that a chemical, or whether it is hazardous or not, or if it is hazardous, what kind of hazardous material is there. Even some of the material suspect it may be give hazardous, so the company will register that kind of material. Even that also you can see it in that link. So these are all the open source only. I just give it here for your knowledge. So earlier I mentioned, right, that the limited exposure. Limited exposure means it's up to 24 hours. If somebody is some device is getting contact with the body for less than 24 hours, then it is classified as limited exposure. 24 hours to 30 days, then it is prolonged. If it is more than 30 days, then it's a long-term exposure. And there is another kind of a body contact also there. That is the transition. If it is any device getting touch with the patient body less than 1 minute, then we can go for the transition body contact. For that kind of body contact, we can write the justification. So we no need to provide any, we no need to do any test, but we need to write the justification. So for that, we need the chemical characterization. So we have to know about the chemistry. And but but the transition device have anything coating, or it leaves something leachable to the body, then certainly we have to do the toxicological effect, toxicological studies. So based on the duration of the contact and based on the body contact, they will set it up what kind of test we have to do. For an example, cytotoxicity, sensitization, irritation studies obviously we have to do for all type of body contact and all kind of for any duration, limited, prolonged, or long time exposure. And the next slide. In the next is so okay. This slide will shows that what kind of test we have to do based on the body contact and also based on the duration. I'm just saying time. So the guideline will most of the guideline will say that what kind of they will give more options. What kind of extraction material you can use for the toxicological studies, same like the chemistry extract and leachable. So we have to careful about that to choose the solvent to extract the material to perform the toxicological studies. So if you know, again, if you know about the chemistry, then it will be easy to choose the the solvent one for to do the extraction study. And also how much extraction volume we have to use, it's all based on the thickness of the material and what kind of material it is. We don't want to do the extraction in larger volume, and we don't want to dilute the ingredient. And also they will give a lot of advice, or the guideline will say that how you to do that extraction. So after extraction, you don't want to do anything. Don't do any filter, because when we do the filter, you can purify some of the chemicals, right? So you don't have to do anything. You filter and don't do any centrifugation. When you do the centrifugation, the higher molecule may get settled down. So don't do anything. And extracts should be stored for at least for 24 hours only, not more than that. So all those things they will tell you in that guideline. So why I'm telling the guideline is because we have to strictly follow the guidelines. That is the most important thing. And also, if it is for the cytotoxicity, so the mixed polar is more advisable. So the mixed polar is more advisable means what? So we are cytotoxicity is performed in cell culture. So cell culture media is media with serum. So that is the mixed polar. That is the reason. So if we use the same media with serum for the extraction, then we can directly use it for the cytotoxicity study. And for the irritation, if the extraction after the extraction, we have to measure what is the pH. If the pH shows less than 2, or if it shows more than 11.5, then certainly it will create the irritation effect. No need to perform any animal studies. So that is the one. And for anything, for any irritation study or for the sensitization study, we need always need the positive control along with the negative control. And for that, to save the animals, if we have any positive control report from last 6 months, then we can use it for this study. But all the protocol and everything should be same. And if you do the sensitization study, it is same applicable for the pH. If it is less than 2 or if it is more than 11.5, certainly it will create the sensitization effect to the body. No need to do any animal studies. And also, don't create any false positive result. For an example, if you do that local lymph node assay, LLNA, and if it has anything lead or anything or metal, it may create some false positive result. So mostly the people will go for GPMT, that is the guinea pig maximization test. So it is good for that mixed compound. LLNA is good for that single compound, and this one is good for that mixed compound. And so most of the people they will go for the GPMT test for the sensitization study. And also we can save some of the animal by combine two of the test. For an example, if you are going to do the implantation study, then in the same implantation study, you can that animal can be used for the kinetic study also. So like that, if you are going to do the systemic toxicity study, then you can perform the carcinogenicity and also the toxicokinetic study. And also in the pyrogenicity study, material mediated pyrogenicity is different, and bacterial mediated pyrogenicity is different. So for the toxicologists, mostly they concern about that material mediated pyrogenicity study only, and it perform in the rabbit. And for the carcinogenicity study and for the reproductive and any developmental toxicology study, if you have that strong chemistry, then you can write the justification. Or based on the extractable and leachable study, you can write the justification to avoid the toxicological study. For the reproductive, we have to do for at least 2-3 generation study, so we can save a lot of time also. If sometimes if it gets failure in that toxicology study, then before go to the another toxicological study, we will use some of the extract and leachable study to identify whether it contains any hazardous material or whether it contains any toxic material. So for that one, what kind of material we used in the toxicology, what kind of solvent we used in toxicology, and we want to know what is the surrogative when we do for the extractable and leachable study. So those few of the materials, the solvent I listed over here. And also initially I said that we have to know about the sterilization also. If we expose some in ethylene oxide, some of the material in ethylene oxide, maybe it will get interaction and it may create the toxicology effect. So same like, if we want to know what kind of material we have to use for the gamma radiation also, because some of the material, if you use it in controversial sterilization, then it may create some of the adverse effect. Okay, now I go for the question time.
Okay. Thank you, Prakash, for the wonderful lecture. You have given about toxicological studies, about the OECD guidelines, toxicity testing, and about leachable and extractable, about the extractable things. So thank you very much. We have few questions over here. Um, Actually, for dental implants, which type of study is the best? Leachable or extractable study?
So that's a that's a tricky question. Actually, I would like to say that it's based on that material, and it's purely based on the type of use also. So
Okay.
some people they will use both extractable and leachable study, but to save the cost and the time, some people they go for that extractable. Mostly, some people they go for the very only extractable only,
Okay.
and they will do it. I would like to recommend that extractable study. Mhm.
Okay. Thank you. So the next question is, what is the most toxic monomer? So you were
Um,
telling about the monomer, right?
yeah.
Ah,
So I can say that is terrain because it is the one I mentioned when I read it in the New York that regulation. So I remember that terrain one is the one.
okay.
Yeah.
If it is toxic, how to counteract the toxicities? If
Control.
you know that, yeah, counteract or control the toxicity. Otherwise, yeah.
No, so if the hazardous material is present in the device, or if it is in the material, then it, it is better to avoid the material only.
Okay.
Yeah, or we have to do that regular manufacturing process to avoid the monomer. And if it is for the toxic material, then we have to go for if it is toxic. then we have to go for another material only.
Okay.
Mhm.
The next
Actually,
question.
yeah,
Yes.
when we do that, when we buy the material, you can ask it to the manufacturer, the vendor, whether they have any biocom test or any toxicological test for that material. Even for that single ingredient, most of the company they do that toxicological study, and they can say that this is the one we certified. This material doesn't have any hazardous or any toxicological effect like that.
Okay. So what would be the alternative for this phthalate?
So now they find a different material. Suddenly, I couldn't remember now, but they found that a different material for the phthalate. So it
Okay.
also make that plastic very much flexible. But from at least till date, they didn't find any hazardous in that material. So phthalate is a kind of a plasticizer. So in the plastic, in the PVC, they added that phthalate to make it more flexible. Actually, I will say another one interesting thing that one of the person he bought that a lot of food containers, food storage container, very colorful, and they are because of the color and because of the other ingredient material, it should have some side effect. So we don't want to see that whether it is very flexible or it is very colorful. Instead of that, we have to see what kind of ingredient they added it.
So what are the key parameters to ascertain the biosafety of biomedical device with minimal toxic effect?
Actually, that biosafety is a different word, but biocompatibility. So we have to use that based on the body contact and that duration only. I showed you that one of the tabular column, right? So in the tabular column, cytotoxicity, sensitization, irritation is common for all kind of body contact and duration of contact, whether it is for 6 hours or whether it is for 30 days or 90 days. This three toxicology studies very must. And also again we go for if it is for a different body contact and a different duration of period, then we go for the emo blood test and pyrogenicity, and also we have to go for the acute or subacute or chronic study, and carcinogenicity and reproductive all come later for the longer time. But as I said, if you have the strong chemistry, then we can avoid that reproductive and carcinogenicity study. Because we have to follow that animal ethics also. We don't want to unnecessarily give that carcinogenic material to animal for study purpose only. If we know it is going to cause the carcinogenic effect. And for the reproductive, we at least we have to go for a 2 generations study. Then it will take a lot of time. So if you know about the material ingredient or if you are good in extract and leachable, then we can try to write the justification. And most of the people they try to avoid the novel material because novel material we don't know
Study.
what kind of material is there. So mostly they try to go for the material which is already in the market, or at least they are what else they are using in the company. So they will say that we are using the material, so we can avoid that this kind of carcinogenicity and reproductive. But some of the tests we can't avoid. We can't write the justification. So we want to know about that one.
Okay. Thank you, Prakash. Thank you once again.
Yeah.
Over to Ramya again.
Thank you so much for the wonderful presentation. We had definitely got an idea on the biocompatibility of any material and the guidelines which should be used while choosing the material. Thank you so much, sir. Thanks for accepting our invite also.
Yeah, thanks.
Uh, Yes,
Thank
sir.
you.
I would
Thank you.
also like to thank the institution, Sri Balaji Dental College and Hospital, Dr. Sumati Jones ma'am, head of the Department of Pharmacology, for conducting the series of webinar on DENTOPHARM, and Principal Dr. Jimson sir and the organizing committee Dr. Satish and N.P. Murli. A special thanks to Dr. Nishat Sheikh and Angelin from Dockmood organization for the technical support. And thanks for all the audience who participated in this webinar. Thank you so much.